Here we see the peristernal long axis view of a patient after mitral valve reconstruction. You may notice the more echo-rich mitral annulus area after reconstruction. The left atrium is relatively large, which still indicates the significant mitral valve regurgitation that existed previously. The opening and closing movement of the mitral valve appears to be quite normal. In the short axis view, you can see that the wall motion is not totally normal. If we focus on the mitral valve, we see structure in the area towards the anterior septum that is not regularly visible in the short axis at the mitral valve level. A similar structure may be seen in a patient with hypertrophic obstructive cardiomyopathy in the sense of a caudal SAM, but hypertrophic obstructive cardiomyopathy is not present here, as we have already noticed in the peristernal long axis view. It appears that the structure is being moved by the blood flow, giving the impression that the structure is waving or appears like a waving hand. If we now look at the four-chamber view, we can see that the reconstructed mitral valve apparatus was actually responsible for the impression in the short axis. We can see that neocordia were inserted both close to the mitral valve and closer to the papillary muscle. There is also a neocordia or floating suture near the papillary muscle. It is important that if a suture was placed and the artificial suture was not connected to the valve, that this finding is documented in the surgical report. Otherwise, it may well be mistaken for endocarditis in a follow-up echo that is not very timely. This clip demonstrates that timely echocardiography is generally important after mitral valve reconstruction, as a correct description of the new anatomy with echocardiography is important to detect alterations or degeneration later on. Finally, we take a look at the two-chamber view and see the floating seam again.